what can we do there?
Flexion extension. Oh, sorry.
Sorry, not physiological motion.
Anterior, posterior. Oh, that wouldn't make sense, would it?
Not really, right? Because, and I only say that because, so this is an anatomical, this is one of those things, right? And remember, the ulna is going to come around, and it's got a hook, right? So there really is no anterior posterior because the hook is in the way. So that really doesn't exist. So what would we have? So medial lateral, but we have to disengage the hook, right, to go medial lateral. Or we can distract, right? We can try to get the hook to come more out of the joint, right? The other thing we could do at the joint itself is gap it. So we're not worrying about bringing the ulna out of the humerus. We're more looking at opening up the capsule on the sides. It's also going to be a special test that you're going to learn, varus and valgus stress test, but what we're going to use it for in this class is more joint mobilization. So the closed pack position is in extension, right? So if I want to do a gapping motion, I want to open up the lateral side of the joint, okay? I got to stabilize the medial side of the joint. And then I have this beautiful lever arm down here to work off. So I can do this in standing. I easily get up over the joint. This isn't moving, the force is here. Okay? And I'm pushing this way on the outer part of the radius and gapping so the outside of that joint. See that opening there? So that's what we're testing for. So that's a joint mobilization you can make for the humeral ulnar joint. You can also do medial gapping. It's the exact opposite, stabilizing in the lateral part of the joint. And we're pushing this way. So we're opening up the medial part of the joint. Again, that's going to end up being a special test to assess the collateral ligaments as we get into maybe adulthood. We do that. Is that right? Yes, okay.
In the fall.
In the fall, right.
Yes.
We're not making anything truly happening at the humeral ulnar joint in the open pack position because that's the closed pack position. The open pack position, you got to get upwards to 70 degrees with at least about 10 degrees of supination. Why? What's the anatomical event that's occurring in full extension? The hook's going deeper in to the joint, right? When we come into flexion, it's backing itself out. So now we're in the open pack position. In theory, what we've done is now started to move the hook out of position, or out of its locked position. So now it's going to be a bit of a counter force. So if I want to laterally gap the ulna on the humerus, right? Stabilize the humerus. You got to get control of the arm. So you kind of pin it in your body. And what you're going to do is put a force down. So that would be a lateral glide, right? Lateral glide of the ulna on the humerus. Or the opposite, right? Again, you got to get up in about 70 degrees. And that would be a medial glide. Right, of the ulna on the humerus. The other thing we could do in this position, at about 70 degrees, you get right in here. Now, right, it's coming outward. Distraction now is going to be this way. If you come in here, control right up on your shoulder in there. The vector is down this way. That's distraction of the joint. You'll see some therapists, and not necessarily inappropriately so. Is there another small towel? Doesn't matter, you can do it with your hand. You could possibly put your hand right in there, or a small towel, right? Create a little downward force, and then press into your own hand. And in theory, what that's doing is it's popping the hook out backwards further, and then distracting it with your hand becoming the fulcrum. So you're pushing downward, and then bending up into your own hand. That's an alternative way. This gets a little more true gapping, okay? But it's all how it fits how your hands fit. So you have gapping, medial, lateral. 70 degrees, 10 degrees of supination, lateral glide, medial glide, distraction. Good? Okay, we're gonna do those